Welcome back, guys. Today on our topic on premature ejaculation, we are going to deal on the nursing part. And normally the nursing part, we measure on counseling our clients on ways or other techniques of delaying ejaculation. So we have various ways of delaying ejaculation, and these are some of the most common methods that we counsel our patients on. Number one, we use distraction method. In distraction method, this is where we encourage open discussions between the man and the woman, rather the husband and the wife. This is when immediately after penetration, whereby the wife comes up with either a different topic or rather something different that temporarily takes away the mind of the man away from the sexual activity, and in the process the man is able to penetrate for long without ejaculating. By distracting the mind, therefore the mind of the man is temporarily taken away from the sexual activity and is able to dwell on something different, and then comes back, and then in the process the penetration period could have taken long, and therefore the man is not able to ejaculate immediately after penetration. Another method that we use is we advise the man to use a thick condom. This thick condom decreases the sensitivity of the penis, and therefore when there is decrease in sensitivity of the penis and the man can engage in foreplay for a long period of time, the man can penetrate, and because the sensation of the penis is reduced, therefore the man can stay long without reaching orgasm or without ejaculating very early, and therefore the period in which the man takes to ejaculate is lengthened. Another technique that we use, we encourage the man to take a deep breath. This is immediately after engaging in the sexual activity, the man takes a deep breath. This is done to shut down the ejaculatory reflex, and once the ejaculatory reflex is shut down, it therefore means that the man has to start all over again, will be aroused all over again, and therefore it means that the man will take a very long period. The man could take a very long period before ejaculating. Another method that we normally use is that we encourage the woman during the sexual activity to stay on top. This is simply because when the woman stays on top, then the man is able to know when he's going to ejaculate, and therefore encourages when he's going to ejaculate, informs the wife, and then the wife pulls out. So when the wife pulls out, the reflex goes down automatically. So when it goes down automatically, then it means that the wife still can come back to her position and the man has not ejaculated, and then they start all over again the process. Another common method which we normally use, it's called the squeeze method. In this squeeze method, this is where we firmly squeeze the shaft of the penis so that the erection partially goes away and the impending orgasm subsides. This is where, when after penetration and now the man is almost ejaculating, withdraws. Once he withdraws, then they squeeze. He or she can squeeze the shaft of the penis. So when they squeeze the shaft of the penis, then the impending orgasm subsides. So when it subsides, it means the man is not going to release, and therefore the ejaculation is going to be delayed. And this squeezing can take place for a period of like 20 to 30 seconds, and then they go back to the process. Another technique that we normally encourage our clients to use is the Kegels exercise. This is exercises that are normally done to strengthen the pelvic floor muscles. So it's also called pelvic floor muscle therapy. This is normally done, we normally encourage the man during urination to hold the urine in between the urination. To hold, you hold, you continue, you hold, you release, you hold, you release. So in the process, the pelvic floor muscles are strengthened. So when they are strengthened, it means that during sexual intercourse, this man can voluntarily hold the ejaculation. When it's coming, he can hold it. And when he holds it, he's able to hold it and then to release, which means he can be able to delay the ejaculation by holding it, releasing. But this one must be first be practiced, because if you don't practice to hold, then it means you will try to hold it during the sexual process and it will be unsuccessful. Another counseling that we normally do is we encourage men with poor body image, because these are majorly the men whom you find with this condition. So men who think they have poor self-image, or rather poor body image, this may be due to early maybe sexual experiences, maybe a bad sexual life, or stress. Then these men have to engage in activities that boost their self-esteem, boost their self-worth, so that they feel valued, they feel they are good, they feel they are just normal like another man. And therefore during the sexual intercourse, then therefore these men are able to perform, improve their sexual life without feeling they are underperforming, or rather they are not satisfying their partner. These are the ways that we normally encourage our patients to use, and they can be used in combination with the pharmacotherapy, that is in combination with the medication. But normally, because this is a condition that is reversible, that is curable, we normally encourage them to majorly continue with the exercises, use the distraction, be open in case of anything, because the sexual life is not something that you can open up to any person, but they can have either one healthcare practitioner, one nurse, one doctor whom they are so free, so that in case of anything they are able to interact, they are able to seek clarification, they are able to, a problem is able to be identified early before it goes long. Otherwise, we encourage all of you to visit a healthcare practitioner if you have this problem. And normally it's the wife who comes up with this problem, because there's a dissatisfaction between the partners. So females, wives, or other partners, if you have a problem, or if your partner is experiencing such a condition and is not able to open up, you can come to the hospital. Then through open one-on-one discussion, talk therapy, we are able to sort this problem and we are able to enjoy a healthy sexual life.